So Eva, whenever you're ready, okay?
Okay. Actually, I can start. Hi, everyone. Is everybody hearing me?
Yes.
Yes, hi.
Yes.
Hi.
Hi. Hello.
Hi. Hi. My name is Eva, and I'm one of the librarians from LaGuardia Community College Library. I'm sorry, guys, I can't meet you in the classroom, but hopefully that's going to happen next semester. Eventually, I'll see you in the library if everything goes well. I'll try to give you brief information about the library, and especially how to do your assignment, how to find articles on cultural competency. But first, I want to show you briefly and share some information about the virtual library, because the physical library right now is closed, as well as the rest of the campus. And you don't have access to the library, so we have to do as we do. We also don't have actually access to the campus. So everything needs to be done online, unfortunately. I'm going to stop my video because it's messing up sometimes. Okay, and I'll try to share my screen. That's neat. Okay, and I'm gonna go to the college library. Can you see the college library?
Yes.
Okay, great.
Yes, the main page.
Okay, I'm sure that most of you are familiar with the college library, right? You're using it all the time. But to do research, to use the library services, you have to go to the library page, and a lot of students are asking how to get there. Here on the homepage of the college library, you have links library. On the top right toolbar, there's a link for the library. When you click, you can go straight to the library page that looks like this. And also, if you go to My LaGuardia, your student's LaGuardia has also linked to the library. So there are two options. You can either use the library link from the homepage of the college, or go to My LaGuardia and follow the link in My LaGuardia. But definitely when you have to do research, you have to be on the library page, and the library page looks like this. The library is closed, but we do provide a lot of services for you guys. And most of the information is here on the page. You have to just know where to go and what to do. Get help, there are plenty of options. The most important is Ask a Librarian. The library is closed, but we're online. You can chat live with us. Here you go, you have to just type in your name, question, and start chat right away, or you can email the library. We usually get back to you within 24 hours, even less, if you email us with your questions. And the time for chat reference is not available here, but if you go to help from home, there's also a link to chat with librarian. Okay, we have already the page to chat with librarian, and if you scroll down, you have the hours here for chat. This is actually the schedule of the physical library. We usually open Monday to Thursday, 8 to 9 p.m. and you can see on Saturday and Sunday there are less hours. But all during these hours, there's somebody online, librarian online, and you can chat and get assistance with your research, ask any questions you can think about. We try to help you as much as we can. So that's very important. Homepage of the library, get help, ask a librarian, and you can either chat with librarian or email the librarian. The next one is help from home. We did set up this page last semester when we had to close the library and work online. We have all the library services and everything that you'll be able to access from home here on this page. In addition to Ask a Librarian, you have borrow library materials and equipment. Unfortunately, right now, you cannot borrow any print books, neither textbooks if they're print, no laptops, no tablets, nothing. Library is closed, and unfortunately, you're not going to be able to borrow anything of the physical holdings of the library, like books, print journals, magazines, newspapers, audio-video materials. But we do have a lot online. and that's what you'll be able to use. Free textbooks, unfortunately, this semester there are no free textbooks. They're not so generous anymore, but you do have some options. And also I want to mention to you that the public libraries are partially open now. And if you want to borrow a print book, you can request a book from any of the nearest public library you have, and go pick up the book when they tell you that the book is available for pickup. But definitely if you go here, online library materials, you'll see what we have available online. Ebooks, we have more than 500,000 books online. I know that some of you prefer the print book to be in your hands, but unfortunately right now this is not happening. That's why we're stuck with everything that's online. We have a lot of databases, more than 130 databases, and I'll show you exactly how the databases work and how to search in the databases in a while. Plenty. I know that it's a lot of information and you'll be confused. That's why if you don't know where to start, how to do this, just ask a librarian. Go to help and ask a librarian. Let's see what else we have here. Ask a librarian, help from home. Citations. For this particular class, you need to use APA style and do a citation as well as we'll talk about this in a while, but this is where you have the information, how to do the citations, and additional information about the tools. What else we have here? Off-campus access. That's very important. When you're using the databases or you're trying to read a book online, at some point you'll be asked to log in. Your login is your first name, last name, and the password is your CUNY first ID and the last 2 digits of the year you're born. The information is right here. You don't need to know this by heart, but at some point you'll remember it. And last one, but important, tutorials and handouts. I'll show you briefly how it works, but if you need extra help, you can go and use any of these tutorials. Like the database will be searching in CNAL Complete, and it's similar to Academic Search Complete. So if you go to Academic Search Complete, you'll see that there's a video tutorial and it gives you information how to use Academic Search Complete. Any questions up to here?
No.
No? Okay, guys, I know that right now you're not gonna have any questions because it's a lot of information, but when you have questions, please don't be shy. Just either email us or chat with us, get help. That's why we're here. Okay, anything else here? I don't think so. Just browse the library page, take a look what is available. There's plenty more information. I'm not gonna be able to show you absolutely everything, but you can just browse, take a look. And if you have any questions, feel free, email me. I think your professor already shared my email with you guys. Or you can just come and either chat or email us on chat reference. Okay, now for this particular class, we have to work on a topic, cultural competency. Are you familiar with the assignment?
What is it?
Your assignment, are you familiar? Cultural competency. You need to find an article on cultural competency and your major, nursing or radiology or whatever you're going for.
No.
No, you're not.
No.
Yeah.
Okay.
How was that?
Have you seen the video about cultural competency, or you didn't have a chance to do this?
No.
Not that I know.
Okay.
You don't know that.
What happened to my video? Library instruction. Okay, I guess, here you go. That's my video. Okay, I'll show you briefly the cultural competence video so you can get some idea what cultural competence means and what we need to talk about. Okay, let's hope it's gonna work. Okay, it works.
Governmental regulations and the Joint Commission for Accreditation of Healthcare Organizations, JCO, require that all healthcare facilities practice culturally competent care. Meeting this mandate appears daunting, as ethnic groups once relatively isolated within national borders now actively move around the planet, and we have reached unprecedented levels of cultural diversity. As populations in many countries become increasingly diverse, so does the difficulty in learning the specifics regarding culturally related behavior. Achieving cultural competency requires that we have an understanding of the major components of human culture, that we understand our own biases, and that we are knowledgeable regarding the customs and expectations of those cultures we commonly encounter.
The purpose of this series is to provide tools to enable you to meet these goals. We'll discuss some specifics from various cultures, and we'll show how just by listening and observing, you can interact with your clients in a productive, effective, and culturally sensitive manner. Traditionally, culture is viewed as being related to race, religion, language, and country of origin.
However, cultures contain many divergent groups called subcultures, which directly affect how people think, act, and view others.
These subcultures include occupation, economic or social class, age group, and political affiliations.
People also find themselves grouped because of the presence of physical disabilities, deformities, developmental delays, or physical or mental illnesses.
Sometimes it's easier to see our differences rather than see what makes us alike.
This woman is 30 years old and unmarried. She is Vietnamese, born in Saigon. This man is 45 years old, married with grown children. He is African American and was born in Los Angeles. It is hard to imagine that these two individuals have any common ground. However, they are both physicians who work in a major medical center. They share an enormous amount of knowledge and experience. This woman is in her mid-30s and paraplegic from a spinal defect. She has had multiple surgeries. Though intellectually normal, frequent hospitalizations have interrupted her attempts to complete training programs and left her dependent on public assistance. She is politically active on behalf of those with physical and cognitive disabilities. This woman is 46 years of age and in excellent health. She has a master's degree, is a successful real estate broker, and is politically indifferent. These two women appear to be poles apart, with no common ground, until you realize they are both single mothers. But the real question is, how do our individual attributes and experiences impact our ability to live and work together?
Increasing cultural diversity makes effective communication more challenging. In healthcare, the difficulty is increased because we see people at their most vulnerable.
People of all ethnicities, ideologies, and economic levels come to us because they're sick or injured. They're frequently frightened and may also be in pain. When a patient has a cultural orientation that's different than our own, we may find that techniques we normally employ during interactions are less effective or simply don't work.
All human beings have beliefs and biases based on both cultural heritage and life experiences. These can become filters through which others are viewed.
Acceptance of this is the first step in learning to work effectively in a multicultural environment.
For the healthcare worker, this is particularly important. Every day, we are called upon to assess and work with people from diverse political, religious, and social beliefs, as well as ethnic and economic backgrounds. Their only true commonality is they need health care.
Okay. Oh, come on. We need to close this. Are you still with me?
Yes.
Yes.
Okay, great.
Yes.
So I'm sure that you don't see anything new here. We have quite a diversity here in New York City, and you're dealing with this every single day, right? But that's gonna be huge part of your job. So you have to be familiar with this, and probably that's why your department decided to go with this assignment about cultural competency and your major. So what we have to do is find one article from scholarly peer-reviewed journal published in the last 5 years, get the full text of the article, and make annotated bibliography. And step by step, I'll show you how to do this and explain what exactly you need to do. First, you have to find the article. How do you find articles in the library? I know the easiest way for you is just to go and Google. Just have in mind that when you Google, you may not be able to get the full text of the article. You may get just the citation or just the abstract, but not the full text of the article. That's why we're asking you and pushing you to use the library databases. Library database is a collection of either newspaper, magazine articles or scholarly journal articles, as well as database maybe collection of electronic books. In this particular case, you need a database that has scholarly peer-reviewed articles in health sciences. So if you click here on the link, databases, articles, and books online, you can browse the databases by title. And if you go there, you'll see that the library subscribes to more than 130 databases. So you have no idea, that's your first time searching, you have no idea to which one of all of them to go and search. That's why I have the databases by subject. So if you click here, you'll see the database is organized by subject. And of course, you'll go with health and nursing, right? That will bring you a short list of articles recommended in health sciences and nursing. The database that your professor and your department is asking you to use is CINAHL Complete. So let's take a look of CINAHL Complete. Just have in mind that if you're taking veterinary technology or radiology, you may not be able to find articles here, and you may need to go to another one of the articles, databases listed on this list. But let me show you how CINAHL Complete works. And as I mentioned, when you're using databases from home, it will be asked for username and password. For you, the username is first name dot last name. For me, it's a little bit different. And the password is your CUNY first ID and the last 2 digits of the year you're born. Okay. When you log in once, you're not going to be asked to log in every time you're searching the databases for a particular session, but at least once you'll be asked to log in. Don't get confused with EBSCOhost. EBSCOhost is the provider. We have more than 30 databases by EBSCOhost. Try to remember the name of the database. In this case, it's CINAHL Complete. CINAHL Complete, actually, it's a nursing database. I'm sorry, I forgot to mention this. It has a lot of articles from newspapers, magazines, as well as scholarly journals. You don't have a search box like in Google where you have to type in your keywords, and you have plenty of options to limit your research. I prefer to not limit my research before I see if my keywords are working. And let's see how it will work. So we have cultural competency, and it's giving a suggestion in nursing, but it's better to use keywords. What do I mean by keywords? Keyword is something very short, very meaningful, and it's supposed to bring a lot of result. It may be just a word or a phrase, but not a sentence, not a question. And you definitely need to spell and type correct, otherwise you'll be getting 0 results. Why I'm using these quotation marks? Because I want to keep the phrase together, do not separate cultural from competency, and bring everything that talks about cultural and everything that talks about competency. I need exactly cultural competency. And I'm using Boolean search with and, so it will bring all the articles that include this keyword, and it will narrow the search. And search. And you can see that it brought me 1846 articles. That's a lot, right? Now you can narrow the search. And how? All the options we had on the initial page, we have here on the left side count. Definitely full text. You need to have the full text of the article, and unfortunately interlibrary one doesn't work right now because of the extreme situation. So you definitely need to limit to full text articles. You need to have an abstract. This abstract you'll use for your assignment as well. So limit to full text abstract available, and you need to have the last 5 years. Only the last 5 years. That's very important for health sciences. Everything that was published, it's, let's say, in 1950, it's very, very old information. If you're doing something about history in health sciences, that's fine. But usually for an assignment like this one, you need to find the most recent information, and it's so sensitive. The information in health sciences is so sensitive that sometimes you need to go with the last couple of months, like COVID right now. COVID-19, everything that is published is for the last couple of months. And if you need to work on a topic on COVID, you need to go with the last couple of months, not even last 5 years. But for this particular assignment, you need to go for the last 5 years. So let's do 2015 to 2020. You can either drag or just type in 2015. Sometimes it works, sometimes it doesn't. Okay, it did limit to the last 5 years. Now we have to limit just to academic journals. It has to be an article from scholarly peer-reviewed journals, so academic journals only. And pay attention, language. Your professor wants to see the article, may need to read the article. So you have to definitely go with English. I know that most of you are bilingual and prefer to get something in your native language, but if sometimes it's better to use articles in English, especially when you have a lot of terminology. Using an article in your native language, it will be kind of hard for you to translate and make sure you're using the right terminology. So go with English. And we did narrow the search to 143 articles. Don't expect that every single article is exactly what you're looking for. You have to go one by one and take a look. Don't judge them by the title. Make sure to click on the title and take a look of the additional information. Like, let's take a look of this one, Filipino nurses' attitude and cultural competency in caring for mentally ill patients. That's the title of the article. We have a brief bibliographic information that you'll need for your citation. Always when you do a research paper, at the end of the paper, you have a list of references. You need to do citations, and you'll need this information: name of the author, title of the journal, date of publication, volume, issue number, and page number. Something else I want to mention here, you have some subject headings. Sometimes you may have suggested keywords. If you're struggling with the keywords, can't figure out what to use as a keywords and you're not getting any results, not finding any articles, take a look of the subject headings, take a look of the suggested keywords that can help you find and do your research better. And something very important is the abstract. What do you think is an abstract? Any idea? You still with me?
Yes.
Okay.
It's like a summary of the
Like a
article.
Perfect, exactly. This is a summary of the article. It's just a paragraph. It's way easier to read this summary and decide if this is a good article. And you can see that you have the keywords highlighted. So just take a look of the abstract, see if this is good, and then you can easily go and pull the full text. The abstract you need also for your annotated bibliography. I'll talk about this in a couple of minutes. But let's take a look right now of the full text. Usually here on the left side column, you have the full text. It may be PDF or HTML. If you have options, go with the PDF file. Why? Because it's exactly copy of the print article from the print journal. If there are any pictures, any charts, any images, everything will be available in the full text, in the PDF file. And mostly it's black and white, relatively large, how many, 13 pages, not so bad. But these are scholarly peer-reviewed journals. These are written based on research by scholars, scientists, professors, and peer-reviewed means that they were reviewed by at least 2 other scholars in the same field before they were published. Here on this page, you have options to download and print out the article. You need to get the full text, so definitely download the full text on your computer or whatever you're using. And if you go back to the previous page, actually you do have the icons here as well, but I'll go to the previous page with the bibliographic information because you can see them a little bit better. You have again print, email, save, as well as cite. Cite will give you the citation, and as I mentioned to you, you're using APA style. You know what APA stands for? Can you see it? It's American Psychological Association. When you're doing a list of references, it's called references in APA style. You're using the APA style, American Psychological Association. And you do have the ready citation that you can just copy and paste at the end of your paper and you'll be done. The problem is that always you have to double check these citations when they're generated by a citation machine or database like this one, and make sure it's correct. How do you know this? If you go back to the home page of the library, get help, citations, APA and MLA. It's already on APA style. This is an article, but pay attention, it's an online source from subscription database, so you'll go with this information. Here you have how exactly your citation needs to look like, and you have examples if you have 1 author, 2 authors, etc., etc., etc. Have in mind that these citations take more time than to write your paper, so don't leave this for the last 5-10 minutes before you need to submit your paper. Make sure to start earlier and make sure to do this as well as you can. And let's go back to the database itself. So you have the citation. But for this particular assignment, you have to email, so you'll use the email option. You have the PDF file already attached. You have to just go here and select APA and type in your email and send it to yourself. Make sure to use your LaGuardia Community College email. As much as I know, that works better for your e-portfolio. So email, but make sure to have the full text attached as well as the APA citation. Type in your LaGuardia Community College email and send it to yourself. That's fine?
Yes.
Yes, okay. They try to make your life easier. you have to do an annotated bibliography. I'm sure you'll ask me what bibliography in general is, and then what annotated bibliography is. To get the perfect answer, I'll show you how to do this. Go to OWL Purdue APA annotated bibliography. OWL stands for, not for OWL, the bird, but Online Writing Lab. Purdue University, and we need APA annotated bibliography. They have, that's really good, and you can use this for almost all your assignments. If you have no idea how to write an essay, argumentative paper, how to do citations, bibliographies, etc., everything is right here, and you can just pick and do whatever you need to do. They have really nice description how to do this, definitions, etc. So first, annotated bibliography. First, you need to know what is bibliography. And students get confused with biography. Biography is talking about the life of somebody. Bibliography is something totally different. Bibliography is usually a list with bibliographic information for different sources. It can be a list of books, articles, but you have only the citations. And here you go, it says a bibliography is a list of sources, books, journals, websites, periodicals one has used researching a topic. That's what it is, bibliography. What is annotated bibliography? The annotated bibliography is like bibliography, but in addition to the citation, you have an annotation. And an annotation is a summary and or evaluation. So it's on this page, you have what exactly you need to do to have the perfect annotation. You have to summarize, assess, and reflect. It's like a summary of the article, but not exactly. And if you answer all these questions here, you have the perfect annotation. For example, for summarize, some annotation merely summarize the source. What are the main arguments? What is the point of this book or article? What topics are covered, etc., etc. After summarizing, you may need to answer this question as well. Is it a useful source? How does it compare with the other sources in your bibliography, etc., etc. Take a look at this. I know it's something very new for you. It's very confusing, and I know that you're not familiar at all. Just take some time, read this. Remember, all Purdue annotated bibliography APA, and take a look, read it, and then you can sit down and do your assignment. They have even examples here somewhere. I don't see them right now, I'm sorry, and I have this video here. AP handout, let me see. That's not exactly what I want, but anyhow, you have the information here, and I'm sure you'll find the link, maybe it's on the next page, to see how exactly it's supposed to look like. I'll close this page because it keeps bringing some videos. So your professors decided to make your life easier. Instead of writing this annotation by yourself, you'll be using the abstract. Remember the abstract, the summary of the article. You can just copy and paste instead of annotation in your annotated bibliography. So with the site icon, a site icon, and mainly with the, email. With the email, you email the full text of the article and the citation. I think in the email you get as well as the abstract, but the abstract is here, you can easily copy and paste. So you'll use the citation in APA style, and then you'll use the abstract, and that will be your annotated bibliography. And you need to find only one article, and the topic is cultural competency and nursing. Any questions up to here?
Does
No.
it just have to be nursing, or is it just in your major?
Your major. It's supposed to be your major.
Okay. And you were saying something about radiology.
Yeah,
Is
that's
it
what I want to talk to you guys right now.
okay?
Sinal Complete is mainly nursing. They have something about occupational physical therapy, eventually nutrition, dietology. But if you go with, I'm not sure how much it has about radiology, I don't remember to be honest. But let's say veterinary technology, I don't think you'll find anything here. That's why you have this option here, choose databases. We have it also on the initial page. Let me go back. So databases by subject, health and nursing, and we want to see now complete. You see right next to the title, you have choose databases. And it's letting you choose within the databases by EBSCOhost. And you do have other databases in health, like Medline Complete. Where's Medline? Here you go, Medline Complete. You have somewhere here, Health Source, Nursing Academic, Health Policy Reference Center, etc., etc. That's why, but you have also multi-subject databases like Academic Search Complete. Somewhere you should have Master File Complete. Where's Master File Complete? Here somewhere. There are a lot. That's why if you are not in nursing, better go and select all these databases. Click OK. And now you're not searching just Sinal Complete, but you're searching the rest of the databases coming from EBSCOhost, from the provider EBSCOhost. And now I can do cultural. I'm sorry, I'm slow today. See well. And let's see, you're looking something in veterinary technology. So what you can do, it's a trick. You can go up to veterinary and asterisk. Where's the asterisk? Here you go. An asterisk. That calls truncation. So everything that is veterinary, anything that starts with this with veterinary, it's gonna come up. And let's see, that's not so bad. 57 articles. Again, you're limiting to full text, peer-reviewed, abstract available. It's 2017. That's fine. Actually, just one article, but at least there is something. And you can see if it's something that you can use. Educational, social, cultural competence. You have to just take a look of the abstract and see if this is really something you can use for veterinary medicine. But it says here, at least the author is affiliated with veterinary medicine. But that's how it's supposed to work. If for some reason you're not able to find anything here, you'll just go back and take a look of the rest of the databases that are listed in health sciences, as well as you can just go back to databases. And here under quick links, you have more databases listed like Appearance Viewpoint, Master File Complete, Nexus Uni. If you're not able to find anything, then just you can either email me or chat with librarian and to help you find what you're looking for. Same for, like, say, a radiologist. Instead of typing radiology, you can do, oops, radio right here. And let's see what's gonna happen here. Not so bad, 7. Actually, something else you can do, instead of cultural competency, you can do cultural competence. Let's see if it's gonna be better. Yeah, 9 articles, not so bad. You can just go with, instead of cultural competence, you go with culture. Not gonna need quotation marks here. Just think about synonyms and play with the keywords. That's even better. You can try to now, if you have culture and radio, and you can, let's say, type in race, be more specific. And you have 3 articles, which may be not so bad, but you don't want to click on the title and take a look and see if it's something good and if it will work for your assignment. Any questions?
No.
No questions?
Radiology one. What if there aren't any within the last 5 years?
Talk to your professor. Ask your professor if you can use
Because I saw that one, it was 2014.
20. Yeah, talk to your professor and ask if you can use the one in 2014. And also, there are more databases that you can use. I think they're listed here. Kill ebooks. No, that's not what I want. Yes, we have to go back by subject. Health sciences, health and nursing, sorry. Like this one, Health Source Nursing Academic, I think it's coming from a different provider. No, still EBSCO, sorry. I'm wrong. Should be maybe this one, Nursing Allied Health Collection. Yeah, that's coming from a different database. Databases have different interface, but they have the same options for search. And let's take a look here, like, I'm gonna go with culture. Make sure to spell correct and type correct, that's very important. Otherwise you're getting 0 results for sure. And radio, search. Not so bad, but these are just magazines. That's not good. You need to have a peer-reviewed journal article. Maybe if you stay with CNAL Complete, stay with the EBSCO databases, just change to culture and radiology. Let's try to do choose databases. All okay. And let's do culture. Oops. Culture and radiology. Not so bad. Full text. Period. Change. Yeah, change. Reference. Abstract development. No. No references. I don't need reference. I need abstract. I don't have here an option for abstract. But if it's a scholarly peer-reviewed journal, it will definitely have an abstract. So don't worry about this. What happened? 2015. Okay. Not so bad. And just make sure here to limit to academic journals only. And language, English. My Turkish is not so good. German is not so good. Definitely English. And here you go. You have 2,606 articles. You can add, let's say, race. Why not? And there are 6 articles. Just play with the keywords. That's how it works. If cultural competency doesn't work, try cultural competence. If cultural competence doesn't work, try culture. Any other synonym you can think about, just use it. Or you can just go with radiology and race, or language, or what else, age, anything you can think about. Just play with the keywords. Make sure to play with the keywords until you get exactly what you're looking for. I know that it's hard. It's not going to be easy for you guys. That's why I'm asking you, just contact a librarian and work with librarian if you're not able to find anything. Any questions?
No, thanks.
No questions for now? Okay, just take a look at the library page. Try to familiarize yourself with the library page. Unfortunately, you're going to use it all the time for your assignments. Let's hope next semester we'll be back on campus. It's much easier when you talk in person to librarian. It's easier to explain. For now, we're stuck with chat reference and email, which is also a help. We try to guide you as much as possible. You can email me as well if you have trouble finding anything. Just get help, guys. Don't waste your time. I had a lot of students wasting hours, not able to find anything. Come to the library, get the articles right away and say, why I didn't do this earlier. Just get help. Don't be shy. Something else I want to warn you, don't leave your assignment for the last moment. Unfortunately, we rely totally on technology, and technology is not very reliable. Databases may go down, library page may go down, college page may go down, everything goes wrong sometimes, especially when your paper is due. You know, Murphy's Law. So start earlier, make sure earlier to start, find your article, email it to yourself, and when you have chance, just do whatever you need to do. Not just for this particular assignment, for any assignment.
Also, I just want to add to what you were saying. Yes, please have your articles ready because we are going to be using those articles next week to make our annotated bibliography. So take this time now to search for your articles and email it to yourself like Eva has showed us, and just have those ready for next week, okay?
Don't forget to use your LaGuardia Community College email.
Okay.
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 Anything else, guys? Okay, I have another class in a while, but between 8 and 9, I'll be on chat reference. So if you want, you can come and chat with me. Between 8 and 9, I'll be on chat reference. Right now, another colleague of mine is on chat reference. Any of the librarians can help with this assignment. If you need help, you can just go and chat, but I'll be available 8 to 9 tonight. And I'm usually Tuesday, Thursday, and Friday, 1 to 5. On Wednesday, I'm 5 to 9. But it doesn't matter if it's me, any of the librarians can help you. Everybody is familiar with this particular assignment. Any other questions?
please take this time now. If you do have any last minute questions, no question is a dumb question. Please ask it before you go out on your own.
Okay, so today's assignment is just to find an article and email it to ourselves?
You have to find 2 articles, yes.
2 articles? Okay.
I'm sorry, I thought it's just one. Okay, 2 articles then.
Yeah, it's 2. All right, thank you so much, Eva.
Can be just one.
I'm sorry. They keep changing the assignment, guys. I guess you need to find 2. Sorry.
I will double check.
Okay.
I'm certain it's 2, but I will double check.
Just make sure to email to yourself the full text, the citation, and make sure to have an abstract because you'll need all these 3 things. Okay, good luck from me. If you need extra help, please come chat with me, email me. I think your professor gave you my email. I also sent a handout. I hope your professor did share it with you. Guiding very in detail how to get to the databases, but it's simple, just databases by subject, health and nursing. Oh, what's so small? Health and nursing and CNAL complete. And if you're not in nursing, just add all databases and search. And narrow to full text, academic journals or scholarly peer-reviewed journals, abstract available if there's an option, and make sure to limit just to academic journals. That's all pretty much, and just pick 2 articles. Okay, guys, good luck, and hopefully I'll meet you in person next semester. But you can always chat or email me.
Thank you so much.
Thank
you.
All right, ladies and gentlemen, please don't
Enjoy
leave.
your evening.
Thank you. Please don't leave. I have to take attendance. All right, so let me just pause.